Well, hello there, Dr. Brian McKay, not just a chiropractor, Stanford, Darien, Norwalk, New Canaan. Yes. Well, what are we going to talk about today? One of my favorite topics, headaches. Why are headaches my favorite topic? Because one, they're very fun to treat when you get the results that we get here at Core Health in Darien. Uh, I cannot tell you how many people come in here with headaches and walk out of here a couple visits later and not have headaches anymore. What I think happens here is, listen, you watch TV, you got Nerd Tech with Lady Gaga, you got something else with Kardashian, you've got Botox, you've got Aleve, Advil. Listen, Big Pharma has you down when it comes to medications for headaches, but people can still keep getting headaches. So if something that keeps giving you, if you're still getting headaches, is it working or is it just like shutting things down for a while? Well, listen, if I had a bad headache and it could shut it down for a little while, I would too. So I'm not begrudging you that. What I'm trying to say is, are you open-minded enough to understand something? There are many treatments out there that don't involve medication, drugs, shots, etc. Okay, headaches are real. And if you ask anybody, they can't exactly tell you where they come from, but I'm going to tell you where I think they come from. There's two nerves in particular. One is called the trigeminal nerve, which covers some of the nerves on your face. The other is the vagus nerve. And one of the things that we're doing around here lately with a fair amount of success, not actually a great amount of success, is by treating nerve branches that come off of here. And the ones I'm going to talk about today is the supraorbital nerve and the supratrochlear nerve. And then we're going to talk about a thing called the symbicontia. I know I'm throwing a lot of stuff at you right now, but just I'll go back into detail each one. Supraorbital nerve. Now, if you just take both your fingers, put them to where your nose meets your eyebrows, and you roll slowly out, you're going to feel a little, if you press hard enough, you're going to feel a little tender spot, maybe a little painful. That's your supraorbital notch. And that's where that nerve comes out. So what I do is I take a laser and feed that with joules of energy. Now, energy, why would you use a joule of energy? Well, it's light energy, first of all. It's naturally occurring. We harness it. Very similar to photosynthesis. The process is called photobiomodulation. Very big word if you're a Scrabble player. Photobiomodulation. And what happens there is we're using light to fire up a nerve. And this nerve is a branch of the trigeminal nerve. And trigeminal nerve is thought to be involved with headaches. All headaches, no, but many headaches. So think of it this way. Hopefully I can explain this. A resting membrane potential is somewhere between negative 75 and negative 65 millivolts. And what happens is when something reaches this membrane potential, it'll cause what's called an action potential and fire off a nerve. If it doesn't have enough ATP, adenosine triphosphate, the cells you're low on energy, okay? And let's face it, if you got headaches, you are low on energy because one, you're probably not sleeping good. It's kind of like walking around with a 55-pound backpack all day long just to go through your daily chores, daily existence. So what happens is low ATP, low energy go hand in hand with headaches and migraines. And I'm kind of lumping headaches and migraines in together because a lot of times there's confusion. Someone has a bad headache, they call it a migraine. And in this case here, we're talking about firing up nerves right where the supraorbital notch is. And again, put right where your eyebrows meet your nose. Just go out a little bit, press, and you're going to feel tenderness. That's the nerve. That's where the nerve exits. Now, we're also going to dive into, you go out a little bit further, out to the side, and you go to the supratrochlear nerve. Now, supra, S-U-P-R-A, not supra meaning above. And what will happen here is this nerve will feed part of your head right? Like if you just rub above where that spot is, again, you go outside the eyebrows a little bit more towards your ears on both sides, and you press, and you will feel a little discomfort there. Again, by injecting joules of energy in the form of light energy, what we're able to do is hopefully make a difference there by firing up the nerve and restoring that normal membrane potential to get the right action potential. Now, what will happen sometimes too is if it's real too easy to fire, you're going to have more pain, and you want to balance it out to get everybody back to the normal negative 75, negative 65 millivolts resting membrane potential. So hopefully I didn't really confuse you with that particular terminology. Now, we're going to go out to the ear. The tragus is that little thing you can just flick your finger, and right next to the tragus is what we call the cymba concha. Cymba concha. Cymba concha. Cymba concha. What that area is that's the terminal point for the vagus nerve. Now, the vagus nerve is involved in a lot of different things in the body, a lot of different things. It's what I like to do with anybody who's old enough to remember Christopher Reeves, the Superman who had the horrible horse riding accident where he was left paralyzed. The vagus nerve is kind of what kept him alive. The vagus nerve goes all the way down to your stomach. It basically communicates from your intestines all the way back to the brain. So it's a very, very important nerve. And what will happen here is you're stimulating the vagus nerve, which helps in many ways to calm us down. Okay? And so what we do there is we put the laser over the cymba concha. We apply the light energy, again, to affect a calming effect on that particular nerve. Now, I'm going to tell you one other tip here, and I'm going to keep this short today because I'm afraid I'm getting too technical. If you have a bad headache, naturally you think you put the little cold ice on your forehead. If you want to get a little bit more relief, put it on the front of your neck. Yes, put a nice washcloth dipped in ice water or even ice right on the front of your neck. This will help get that vagus nerve to quiet down a little bit. So you never know. Now, if you are having headaches and would like to discuss this more, my number, 203-656-3636. 203-656-3636. I'm also going to leave a link in the bottom where you can schedule a time, come in and we can talk about your headaches. Thing I want to point out is you do not need to suffer with headaches. Pharmacological to take care of a short term, I'm okay with it. Long term, why you keep getting headaches? Why you continue to suffer? Think of not only yourself, your work, your loved ones, everything else is affected by you when you have these headaches. So I'm Dr. Brian McKay. I like treating headaches. One of my favorite things to treat. And if you got a headache that needs to be treated, well, give us a call. Again, 203-656-3636. We're in Darien. Been here for 3 decades. So must be doing something right. I want you to have a great day and hopefully have a headache-free life. Take care. Thanks for listening.